Good morning to all of you. I was ready to start my lecture in English. However, I will change to Spanish English because it's necessary to have some concepts understood. I don't know the meaning of some words in Spanish, so you can help me. The idea is to mix a bit, to mix the methodological debate on monitoring and evaluation, and also a bit of the practical experience on how this is done in the management of public policies. Because it's necessary to understand also how the monitoring and evaluation units work in practice in the countries. So this is the idea, to mix theory and practice, but practice not of the studies, but of the way that how we perform the public policy and how we use these evaluation tools. As I have mentioned, I was ready to speak in English, so almost all the slides are in English. Well, first, we're going to talk about the content. We're not talking really, in fact, of a summary, but of the contents of the things I would like to approach. A bit about the meaning of the concept of what is evaluation monitoring, and also the hiring of evaluation studies, especially impact studies, and also the cycles of evaluation, a bit of all the methods, as I've mentioned. I'm going to speak a bit of the methodology, and also to speak about some examples of evaluation impact studies, and also the challenges that we have to face when we design and we try to implement the monitoring. And also at the end, we will speak about the political economy and the evaluation of the monitoring. Well, the first thing that we have to think about when we try to work with evaluation monitoring is to understand the context. Why are we interested in studying a situation, a specific problem, or we have an issue in public policy? This is the first thing, to understand the situation, where we are. So the most important thing, what happens in most of the countries of South America, most of the social policies, is that we're speaking about countries with a great difference. Differences in context, in the implementation of the policies. So we talk about the subnational context, we find very important differences in the demand and the offer. Very different contexts in the ability to manage the government at the subnational level. There are a lot of differences among the countries, but there are also differences in the countries. And for us, it's very important because when we try to implement a system of monitoring and evaluation, we have to understand that the capability of the government to implement in accordance with each subnational context, it's different. So this low capability is also, we can relate to other problems. For example, the low capability of investment, and also, for example, the presence of skilled professionals to monitor and evaluate, and also the low quality of the data, and also the low capability of the data collection. So we have to consider all this and be very clear about what we're doing, because the demand for a monitoring evaluation system is always a very flexible demand because the contexts are different, as I mentioned, and also because in these social policies, they always come with a great expectation of the political players, of the civil society, of the government players, of the political leaderships, national and subnational ones. So we're always involved in a paradox because a low capability and very high expectations to enable, in a brief way, the changes. So for example, when we're talking about a political cycle that starts now in Brazil, we say, well, generally the government has six first months of a honeymoon, but nowadays the tolerance is lower, so we expect immediate changes. So we have to be able to be consistent in order to obtain results in short term. As I've said, in the implementation we also have great differences. Another different thing when we talk about, I don't know if you have had the opportunity to speak about funding all the public policies, but what we've seen is that there is a bit because the political expectations are very high, and also because the demand is also very high, and also because these things are very linked to the political stability of the countries. So the investment in social policies, there is a trend to maintain this ongoing, to continue to the top. Even during crisis times, we have difficulties to cut the funding. So when we're talking about political policies of a long range, we're talking about funding that starts very high, and the maintenance is very high and must continue. And something else is there's a great requirement to permanently adapt because there are great changes in diverse contexts, environmental, social changes, economical changes. So we must have flexibility in the models of social policies in general. And also, in Brazil, for example, as the Brazilian system is very supported in the municipalities, in a certain way, our production cycle starts in a municipality and changes into a national policy. So we use a bit the municipal experience as a test of a policy that is increased at the national level. So it's more or less the cycle of our policy. I don't know if you know it, but in Brazil, we don't talk about piloting. This piloting thing doesn't have much meaning here in Brazil because we use in practice the municipalities, the experience of the municipalities as a reference for a higher and greater model. Are you following me? You know that in Brazil, the second most spoken language is Portuñol, but there's so many changes as speakers as well. So all the Brazilian people think that they speak Spanish and Portuguese at the same time. And sometimes of poor quality, but always we are able to communicate ourselves. Well, let's continue. So why is the information necessary? This is the first question. So the first question, why is the information strategical? Why is it necessary? We speak a lot about evidence, but I would like to tell you that the political dimension of when we speak about evidence, it is necessary to have a rational field to discuss this. So we must have this base. The rationale by itself is very tricky. So we must have a philosophical, scientific reference in order to have feasible negotiations. That's what we're talking about. So the political meaning of the evidence is to bring to the field of the rational is all the public policies have interests of those that receive or the sale services, products, equipment, bureaucracy, and obviously the people that have other interests. For example, the academy that is a mix of these kind of interests. So therefore, the evidence is a reference of the rationale for the debate of the implementation of the policies. That's why we speak about so much about evidence. That's how it works. So the evidence is the accreditation of the functionality of the public action. This is another way of saying what is said here. That the managers require the evidence to implement the political issues, and we obtain using consistent methodology of research in order to obtain evaluation of public policies. What I mean is using another definition is that we must know the effectiveness of the public action. So when we think about public participation, we think about the demand, and this demand is identified in two ways. It is identified first socially. A problem is only understood as a problem because there's a social recognition that it is a problem. For example, diseases, that's how it works. Before, to smoke wasn't a problem. Do you know the book, The Magic Mountain? The people were receiving a treatment for TB in Davos, and they used to smoke because they thought that to smoke used to increase the breathing. So to smoke was not a problem at that time. So first is a social understanding that a problem exists. Second place, that there are ways of classifying and defining that the problem is technical and scientific. So I'm enabled to understand, identify the contents and say, this is a problem. There is a possibility of intervention. It is a problem of public policies because the government has a possibility of intervention. If not, it's another kind of problem. The human species one day will disappear. That's not a problem. Not of public policies. The optimist people think that we will have other possibilities, but don't be worried that nothing will happen now. Not to our children. So information has a cycle. It's a cycle that we can start from the top, saying that there is a definition of the agenda. As I said, it's understanding that it is a problem and we have technology to intervene. And we have the capability to intervene. So we can understand this. This is the same cycle of knowledge, the same cycle of knowledge. When we think about making a research, a scientific research, we think about, for example, we have a problem, but the question depends on knowing the state of art. It's the same in public policies, because when we start understanding the problem, we have to know what we don't know or what we have to know. So first, we have an agenda, a demand, the question, and then we have the implementation, because we know which is a requirement for intervention. So the evolution that is in two places, here and here, we measure the effectiveness of the intervention, and then we go back to the demand. Why do we do this? Because there's always, in the knowledge cycle, there's always a new question. So, for example, the Greek philosophy said, well, what we know, in fact, in English, it would be, we increase the level of the doubt for a higher level. We take to a higher level the doubt. I think that in Spanish it would be to put the doubt over the previous one that is more complicated, and the demand also is more complex to be answered. Is it like that? So the issue in public policies is the same. In Brazil, we say nowadays, as we've changed the poverty situation so much, according to the lower classes, they have increased and improved their capability of purchase. The question is that we're going to have in the future is, what would be the greater demand? For example, we talk about health systems. As we have the capability to have basic answers for the health demand, we have to think about on a more complex level, secondary or third or fourth level. And we have to be able to have the provision of services and assets for a more qualified and complex demand. So we're always talking about cycles that repeat themselves. Restart. Restart. Yes, I'm sorry for my portuñol. So, this is a cycle. There is an idea of having lateral circuits, the knowledge circuit, evaluation circuit, and implementation circuit. Regarding the policy, they're very linked, very integrated, because we have, as I've mentioned, we have the demand, the first understanding of the demand, a higher understanding of what the demand is, and then we have the implementation. And this evaluation at this point, in order to restart the cycle. So to include the demand in a higher level and a more complex one. So why do we need a system, a systemic approach for monitoring and evaluation? First of all, in order to have an understanding of the quality of the services and products that the government furnishes, and then also to produce knowledge on the impacts and costs of the policies and programs in order to be more efficient and at the same time to be more effective, and also to ensure transparency as public resources are used, and also for whatever is important in decision-making in public policies be made in a more rational way, because we're speaking about allocation of human resources, allocation of services, allocation of funding, and of public power. That's why, going back to what I've mentioned at the beginning, we're speaking about find a rational field in order to have a political struggle in a certain aspect. If we speak about in a more restricted way of monitoring and evaluating, what are we saying? It's the same cycle. Now using more the language of monitoring and evaluation. We have a demand of policies, and I don't know if you think like this, but when we think about public policies, we can understand it in 4 ways.
In terms of the demand, this is a formulation by Guillermo Donner, is an Argentine sociologist, very important, who are also here in Brazil. Well, the first thing is that we have to use technology which is available in terms of the demand. Then there's a demand, we have technology. Therefore, this is how we can challenge these ideas. The second thing, okay, we talk about yet another thing here too. But that's also interesting. Yes, let's imagine, for example, there is a demand for better quality health services in a slum or a community, a poor community. Therefore, there's what is used is in improvement in the insurance, in the security of the community, which is another problem which is necessary, but is not their demand, the first demand in place. But this is interesting since it's a way for the state to dialogue with the society. Is one of the ways. There are other ways of dialoguing too. Actually, corrupting leaderships. It's a way also, actually, of contesting this power. If it doesn't work, also you can go to repression, exert repression. What am I telling you all of this? From a viewpoint, these are always present in the public sphere. When we think on this matrix, many times we have to understand that there are things that have nothing to do with the original demand. This is a way on how the state wants to or tries to make its intervention. Once ago, I was working for an international organization. There was a country in Africa that had a program in order to dedicated to improve, he says, or to increase actually the family values. This is a whole program. Actually, it's a lay state. It's not a religious state. How am I going to measure this? How are we going to be measuring this situation? We don't need to measure absolutely everything. This is also something to be considered. Only crazy people want to measure it all. Dr. Freud said this, not me. Not everything needs to be measured. There are things that do not need it. We have to understand why is it the state wants to improve the family values. What are the family values? Yes, but it's a political need in a certain political stage that I don't know. And I didn't have the power to say this state is doing something foolish. I don't have it. Those are specific contexts. And I said, in principle also, when we talk about science and politics, we are trying also to bring to politics kind of rationality. Politics has its own expression, and many times this is a way in how the society understands that this is necessary too. Well, so there are different demands. These demands also, but the comprehension of demands is not well structured. So the assessment systems allows us to have access in a structured fashion to the different initial demands. Then for later on, being able to have a recommendation in terms of policies. And this recommendation for policies this has to be connected or has to be close to the technological options at hand in order to do this. And once again, I repeat, and once again, the cycle starts all over again. Questions? Any questions from the audience? From this part? Okay, you need a sip of water? I need a sip of water to carry on with the presentation. There's something very important. Monitoring and assessment is not information technology. It is a discipline, actually, is an ensemble of different types of knowledge. Let's imagine in epidemiology, epidemiological contemporary cases or studies have more than 300 years. The records or the files of births in the English parishes have more than 500. There were Roman surveys, and also in the Bible they can be found. There were also records of births, and sometimes public intervention would be to kill the newborn baby in the Bible. This is a survey to give the poll in order to guarantee the power against a threat in a certain actually possibility to do repression using a available technology with what was actually a survey or a poll, information poll, and this is in the Bible. It's an intervention. But the problem in the Bible was not the threat. It was political instability, conflict between a dominated population and a dominating population that can co-opt part of the dominated population through a imperialistic project at that time of being able to dominate them even more. So this conflict, this was the characteristics of the conflict with us regular cycles of instability, kind of something like this. But these things are not taught in church. Actually, we use political science for this purpose. Then what is needed? What do we need to do all of this that I just previously mentioned? Firstly, this that happens all of the time. There is availability of information. is analytical information, not only descriptive information is available. Yes, there are reports, there are different reports, then you have access all the time. The, the assessment and monitoring units are important too. For example, what ECLAC, what Isags, what other types of organizations or units or studies unit do on the demands, social demands in Latin America or in South America perhaps. They do produce constantly. It's useful information. It's constantly available. And no, and frequently the intervention, the expected intervention, has to be done in 1 hour or 2. Then it's just a concept that is called political analysis. No, political analysis, yes. This means using the whole available information in a certain given time, period of time. The given time is 30 minutes many times. I can tell you a story. Our Brazilian president, when she was minister of the legislature, then I used to work in the Ministry of Social Development. She called me up. I was vice minister, so I wasn't. It wasn't so usual to call upon a vice minister. She called me up on the phone and she said, "I would like you to see this trend on child mortality, so that you can give me your opinion on this rate." So I work also with social development, not with child mortality. So I thought, well, Minister Temporan definitely would be with her, and she was information from yet another department to know if there's consistency between information sources. And she says, "Okay, I'm not in my office, but when I get there, I'll call you up." She said, "Perfect, you have 5 minutes. I give you 5 minutes to do this." That happened, that is true. I said, "Okay, 5 minutes will do. 5 minutes, that's enough." Imagine. I saw it, and apparently there was consistency, so I called her back. And I said, "Yes, madam, there is consistency. It seems to be consistency, to be consistent. It likes that there's consistency. Is there consistency or no?" I said, "I don't know the quality of the database. I don't know the information. So as far as I can see, I repeat once again, it seems that there is consistency is all that I can affirm." "Okay," she said, "thank you." And she hung up. I never asked Dr. Temporan what happened after. But this is how it goes. The time that you have in order to respond has to be used intelligently. And many times, oftentimes, information, organized information provided by others, making it available, is like internet today. So we also can use statistical information. The statistic bureaus do produce today a lot of information. ECLAC has actually wonderful information. But we have to know what are the databases, and we have to know how to use these databases. We have to master the tools actually for data consolidation. There's something important also here. If information is not well organized, information won't be fully understood. I used to work with a guy, and he used to tell me, it may exist, but I haven't heard about it. If I might have heard it, but I didn't understand it. So your effort is try to say whatever you want. So it is necessary to make an effort of communication, of good communication. What is relevant here? What is really relevant here is that too much light doesn't help. I don't have to say it in Spanish, but actually it blinds you. Too much light blinds you. Actually, I feel fearful because too many people I pay attention to what I'm saying. I'm just blinded by too much light. Your light, personal light. So we have to make a cutoff. A cutoff. So information, especially, I don't know if you have done something that I did, which is an exercise. You have 5 minutes to sell a project. It's a drill. It's a simulation. Example, when I was a professor in university, I told my students, my PhD students, I want you to tell me what is your thesis and what are your hypotheses and how are you going to show your hypotheses in only 18 words. I said, why 18? Well, because if you can say it in 84, in 18, you won't be able to make it in 30 or 40 either. So in the first thing is the hierarchy. That's important. Not necessarily you have the capacity for research information production, but you have to have contracting capacity. You have to know what you are buying in order to be able to contract it out. You don't know what you are buying, that you know what actually you are getting. And it's a permanent problem in service contracting, especially on the universities and the research institutes, is that they not necessarily are producing new and fresh information that will be of usefulness for a certain context. In Portuguese, with this, they are just heating them up again. Reheating information, selling what you already have in stock. So things have to be done well. And also, this is what I said before too. You have to dissemination strategy. There is a necessary structure for the delivery of information, and also there is a need of, of disseminate information using many strategies. When we had here the swine flu. So the swine flu, the piggy flu. In 2009, we used to use Facebook or something like that, another social media tool. It worked, it operated. Immediately, there was available information, actually, also of important things. So depending on the phenomenon, the demand can have a very intense information cycle. But once again, information has to be organized. Otherwise, we all are all lost. What people need to know to do that. First, actually, we have to be concise in terms of providing information. The other thing is, how can we actually tabulate information, for example, using the different tools? Still, I'm talking about ECLAC that has wonderful tools, or be it demographic information. In Brazil, we have IBGE, which is our National Institute for the Studies and Information and Statistics, especially statistic information in terms of population, and they have many tools too. The Ministry of Health does too. For example, also, for example, have good quality information, but we have to know how to use well these available tools. We need to have a strategy and also have to know how to disseminate our information through internet and also different products in order to disseminate information properly. There's a book from an experience in Brazil during the first Lula mandate. There was a team made up by 4 people. I have participated in this group several times. They produced a synthesis of the reports. And in Brazilian journals during the morning with a page and a half for the president to get every morning. It was a page and a half long. It's a book by Bernardo Kuzinski. No, actually, and he wrote it. In Block Peaks, when as president of FINEP, another institute, Leonardo Kosinski, myself, or there was somebody else who made up this four-people team. In a page and a half, we have to say what's important. What is that? We have to understand what your client needs, what matters to him. You have to choose what is important for him and make a very short and effective summary or description of the circumstances. This is type of work, and it's a type of demand that I believe that you also have vis-a-vis your ministers and other officials in your countries. Well,
Okay, some recommendations. In a general way, what is more required, it's not the program evaluation, not the impact evaluation of the programs. In fact, most of the information comes from broader knowledge. Also, the managers require different types of information: qualitative, quantitative, structural, and there is no single method that is true. We do not have any philosophy here to monitor evaluation. No, there are a lot of possibilities. The methods are a virtue and not a problem. But it is important, it's very delicate, politically speaking. When we have, for example, different estimates of a same problem, that's a tragedy. Well, they say, well, there's a mistake. Not necessarily. Different methodologies may produce different information, but we must know how to understand this, and moreover, it's like when we know that this will happen, and it's necessary to prevent this. If something is going to happen, so something I would like to tell you, it's stupid to struggle against different estimates. Oh, there's a mistake in the methodology. There's always we have some mistake. But also when we select our methodology, there we have a mistake. So this conflict of where we have more mistakes of samples or whatever, the variation coefficient, well, it's not like that. There are different methods, and our method, why do we use it? Because it's connected to the legislation, because an international reference. That's then the virtue of the selected method among the others, and not the problems. Many times we have, but not necessarily. So much of what happens in the programs, when we had an implemented program, we tried to change the programs. Many times, this is something that makes people always, they're quite naive, thinking that the programs will bring revolution. especially when they start a new government. Most of what happens in the programs are small changes in their way of working. Of course, it is possible to increase its coverage and other things, but the intimacy with the mechanisms, it's not every day that we see many changes. So, the evaluation and monitoring model in a certain way is possible to anticipate much is what is expected in the program if we know previous experiences in smaller programs or previous programs. And something else also that I would like to say. When we are speaking about a public service, first we're talking to people who work with us. That it's a chain of people, a horizontal or vertical level. This is a type of communication that not necessarily is the same as when we talk to journalists, for example. The interest in the information is also different. The people that work with us are very focused in mechanisms to understand how to do things, understand the problems in doing things. When we speak to journalists, that's another group, they're very focused in what doesn't work, because that is news. That's the only reason. It's not because they're bad people. It's just because they're trying to find the news. Some of them are bad people, but not all. As all of us. And people in general, the ones that fund the public policies, all the others have other interests. That's why when we have the newspapers talking about health information, so they're giving fantastic news about health, of course, there's a sentimental appeal for great changes. We also have this when we're thinking about other things that we don't do. What we do, we're interested in the details. Much of what we produce is very complex and not understandable even by people who work with information. Many times the people don't understand many things, and I'm going to give you some examples. I'm going to be briefer. So this is a definition that Paul Greffrey, this book is available. This lecture will remain with you, so you will have this guide of the World Bank that is very interesting. And there is a different definition of monitoring. There's a continuous process in the public management, and it's very linked to the management because they use managerial information in order to access all the time to what is happening to information. Of course, the periodicity depends on the technological capability. So this is also linked to the social relevance of each policy. For example, HIV or AIDS. So the social importance that this information has compared to, for example, the disease is so great that we have a lot of information on AIDS, so it's possible to have a monitoring on this that is more sophisticated in many cases. Who has a disease, what kind of medication they're receiving, and so on. Not only South America, but in the whole world. When we're speaking about evaluation, we're speaking about a type of information that answers specific questions, generally by period. But of course, we're talking about everything regarding design, implementation, and impacts. And what kind of questions? So descriptive questions, questions that they try to describe what is happening, showing the conditions and managerial context. Specific question, what is happening? And then guidelines. What is this? We have a reference. We have a reference that we understand is adequate. So we have a comparison between what we're seeing and the guidelines. So we can say, for example, that it is necessary that a person must eat 2,200 calories per day. Nowadays we say much better, but this is a standard, a guideline. So we should eat 2,000 and so calories. That is a guideline, a standard. So we have a comparison of what has been consumed and the standard. Or we say a very poor person is very poor if they don't receive every day $1.25 per day. That is a guideline or a standard. And how do we define this? With a statistical average or by a qualitative definition? We ask and define. For example, when we say much is what is spoken in law, human law, or social law, has to do with this, with these guidelines. And finally, the causality, what is produced, and the effect of a determination. And this is the golden rock of the evaluation. So now, to this Peruvian program, I really like this diagram very much because it is possible to see when we start the focusing the evaluation of the offer, the affiliation, the co-responsibilities, the monetary incentive transfers, the services to the user that is linked to this income transference program, information and knowledge to have this monitoring of the implementation of the program, and also the scaling of this. I don't know if you understand all this. For example, scaling is when the family doesn't need to receive the benefit anymore, and co-responsibility is when the co-responsibility of the family in terms of health and education to the children. That is a counterpart to receive the benefit, and that's how the system works. So when we think about a monitoring and evaluation system, we have to understand each step, understand the information under a management point of view, and also when we have some problems, different problems, the first thing we have to think about the problems that we will find during the implementation process. So we have to understand up to what point this happens. When we think about impact evaluation, is that many of the statistical difference of the statistical variation that is found has to do more with the capability of implementation by the government and not by the design of the program. So if we do not consider how the implementation must be followed, we have a very broad focus in the design. We don't understand what is happening. Much of the social interventions that we do are directed to the family, to the community, or the people. We expect a change in the attitude and perception. A change of the attitude to decrease the risk, a change of perception to improve their attitude regarding the risk. But we have a comparison of the design with the effect. We have to understand that there's a change of players and actions prior to reach the effect, when we start from the design to the effect. Then we have to understand this, because if we skip something, we skip from the design to the effect, this chain will be lost. Another way, the Brazilian Bolsa Família. What income transference is done, when this income transference is done, what we expect is a change in how the families decide or select what they're going to consume. So this is an improvement in their income, and as their purchasing decision is about this process, the first change that we expect is a change in the purchase of food. But what about education? Because we have the counterparts of the family. In education and in health, it also depends on the offer. The schools, the health services. For example, in Mexico, Oportunidades is not only the transference program. There's some programs that are not conditioned, even in Mexico. Why? Because they're not schools or health services, or the capability of offers cannot comply with all the demands. So this happens also in Africa. So most of what happens in Brazil comes after this, because of the structure of the offer is also different. It is possible to purchase food anywhere, but not necessarily schools and health units. Imagine, for example, indigenous people, not necessarily the offer is guaranteed. And also the social assistance programs, the distribution is not so favorable as in health and education. And something else also, the economical inclusion. Because to have this economical inclusion for the poor people, it is necessary that the market is more flexible to receive those who have a weaker participation. I have other issues that I would like to mention, but I'm going to stop now just to chat a little bit, and I will go back then afterwards to other slides. So let's stop now, and now I will hear you.